Hey there, and welcome to our video on supplements for PMS relief. In this video, we'll be diving into the world of natural remedies that may help alleviate those pesky premenstrual syndrome symptoms. We'll cover some of the most well-studied supplements, including chasteberry, magnesium, vitamin B6, and calcium. We'll also touch on a few other promising options like vitamin E, essential fatty acids, Ginkgo biloba, and St. John's wort. By the end of this video, you'll have a better understanding of which supplements might be worth trying and how to use them safely and effectively. So let's get started. Premenstrual syndrome, or PMS, is a common health issue that affects up to 90% of women during their reproductive years. Symptoms can range from physical discomforts like breast tenderness and bloating to emotional and behavioral changes like irritability and depression. While the exact causes of PMS are still not fully understood, research suggests that deficiencies in certain vitamins and minerals may play a role. One of the most popular herbal supplements for managing PMS is chasteberry, also known as Vitex agnus castus. It's thought to work by influencing hormone levels, increasing dopamine activity to improve mood, and reducing prolactin levels, which contribute to symptoms like breast tenderness and fluid retention. A randomized controlled trial by Ma and colleagues in 2010, published in the Australian and New Zealand Journal of Obstetrics and Gynecology, found that chasteberry significantly improved moderate to severe PMS symptoms compared to placebo in Chinese women. The typical dose used in studies is 20 to 40 milligrams per day of a chasteberry extract, usually standardized to contain 0.5% agnuside or 0.6% orcubin. Just keep in mind that it may take up to 3 menstrual cycles to see the full benefits. Next up, let's talk about magnesium. This essential mineral is involved in hundreds of processes in the body, including regulating the stress response and managing menstrual cramps and pain. Some research indicates that magnesium deficiency may be common in women with PMS. While clinical trials evaluating magnesium supplements for PMS symptoms have yielded mixed results, magnesium glycinate and citrate tend to be better absorbed than magnesium oxide. Doses used in studies typically range from 200 to 400 milligrams per day. Vitamin B6, or pyridoxine, is another nutrient that may help with PMS by promoting healthy hormone balance and neurotransmitter function. A few small clinical trials from the 1980s and 90s reported that B6 supplementation significantly reduced psychological PMS symptoms like moodiness, irritability, and anxiety compared to placebo. A 1999 systematic review by Wyatt and colleagues, which combined the results of 9 trials, determined that B6 more than doubled the odds of PMS improvement. The doses used in these studies ranged from 50 to 100 milligrams per day, and vitamin B6 is best absorbed when taken as part of a B-complex supplement. Calcium is an important mineral that has been linked to a lower risk of PMS in several studies. It likely helps by supporting healthy muscle and nerve function. In a 2017 randomized controlled trial by Chasteberry and colleagues, published in Obstetrics and Gynecology Science, women who took 500 milligrams of calcium twice daily for 3 months had significant reductions in both physical and psychological PMS symptoms compared to those taking a placebo. Food sources of calcium include dairy products, leafy greens, legumes, and fortified foods. If using supplements, doses of 500 to 1,000 milligrams per day are typically recommended. Vitamin E is another nutrient that shows promise for PMS relief, thanks to its antioxidant and anti-inflammatory properties. A randomized, double-blind, placebo-controlled trial by Zaye and colleagues in 2005, published in BJOG, an international journal of obstetrics and gynecology, found that vitamin E supplements significantly reduced PMS symptoms of anxiety, cravings, depression, and hydration compared to placebo. Good dietary sources of vitamin E include nuts, seeds, avocados, and olive oil. Vitamin E is also available in supplement form, with typical doses ranging from 100 to 400 IU per day. Essential fatty acids, particularly omega-3s and gamma-linolenic acid, GLA, and anti-inflammatory omega-6 may also be beneficial for PMS. A 2011 randomized controlled trial by Rocha-Filho and colleagues, published in Reproductive Health, found that a combination of omega-3 and omega-6 fatty acids significantly reduced PMS symptoms compared to placebo, with greater benefits seen when the supplements were taken for 6 months rather than 3 months. Dietary sources of essential fatty acids include oily fish, flax seeds, chia seeds, and walnuts. Evening primrose oil is another option that specifically supplies GLA. Ginkgo biloba, an herb used in traditional Chinese medicine, has also been studied for its potential benefits for PMS. In a randomized controlled trial by Ozguli and colleagues in 2009, published in the Journal of Alternative and Complementary Medicine, Ginkgo biloba significantly reduced PMS symptom severity compared to placebo, with the most marked improvements seen for congestive symptoms like breast tenderness and fluid retention. The dose used in the study was 40 mg tablets, taken 3 times per day, starting from day 16 of the menstrual cycle. Finally, let's discuss St. John's wort, an herbal supplement commonly used to treat mild to moderate depression. Since depression is a common symptom of PMS, St. John's wort has been explored as a potential remedy. A 2010 systematic review by Canning and colleagues concluded that St. John's wort was superior to placebo for improving physical and behavioral PMS symptoms. The standard dose is 300 mg per day of an extract standardized to contain 0.3% hypericin. However, it's essential to consult with a healthcare provider before taking St. John's wort, as it can interact with many medications, including birth control pills. In summary, several vitamin and mineral supplements show promise for alleviating PMS symptoms. The most well-studied include chasteberry, magnesium, vitamin B6, and calcium, vitamin E, essential fatty acids, ginkgo biloba, and St. John's wort also have some evidence of benefit. However, more high-quality research is still needed for most supplements. It's important to choose high-quality supplements and not exceed recommended dosages to minimize the risk of adverse effects. Supplements can also interact with medications and other supplements, so it's always best to check with a healthcare provider before starting a new regimen, especially for herbs like chasteberry and St. John's wort. While supplements may help manage PMS symptoms, they should be used in conjunction with other lifestyle approaches like regular exercise, stress management, and a balanced diet. If PMS symptoms are severe or not responding to natural treatments, it's important to consult with a qualified healthcare provider for further evaluation and care. That brings us to the end of our video on supplements for PMS relief. We hope you found this information helpful and informative. If you'd like to learn more about natural remedies and supplements, be sure to visit our website at nutritionmarket.com.au. There, you can find a wide range of high-quality supplements and access our virtual clinic, where our team of clinical nutritionists and naturopaths serve clients in Australia and around the world. If you're interested in working with one of our practitioners, you can book a consultation today. Before we go, we want to remind you that while the information in this video is based on scientific research, it should not be taken as a substitute for medical advice. Always consult with your healthcare provider before starting any new supplement regimen, as individual needs may vary. Some of the findings discussed are still under investigation, and more research is needed to fully understand the effectiveness and safety of these supplements for PMS. If you enjoyed this video and found it useful, please give it a like and consider subscribing to our channel for more content on health, wellness, and natural remedies. Thanks for watching, and we'll see you next time.